Welcome to our Discovery Benefit Solutions webinar regarding TEAM-RMS's major medical and benefits programs that include dental and vision. This presentation is going to be regarding the 2013 and 2014 benefits programs, and we're going to explain how they all work, how much they cost, and offer you the opportunity to learn the program and give you the tools as trust officers to be able to explain them to your clients. This is for the plan year effective November 1st, 2013 through November 1st, 2014. And once again, I'm Michael Ponder. We are the benefits consultants for TEAM-RMS. And my partner, Alejandro Moises, is our account manager for servicing the account. And together we'll make sure that as your insurance broker for the trust, that we're getting the best plan possible for the clients and making sure that the value is there and that the prices are as low as possible, and work with the RMS team to achieve that goal. Today's presentation, we're going to explain once again the benefits, but as brokers throughout the year, we'll also serve as a resource to everyone, whether it be a benefits question or a claims problem. And at the bottom of the screen, you can see our 888 number. And you can call us anytime or email us, and we'll be sure to help you out. I'll leave it on here for a second in case you need to write it down. So here's an agenda of what we're going to be talking about. We have some changes going on, but fortunately they're very good changes for what we feel is a better enhanced program. We worked really hard with the TEAM-RMS benefits and office department to make sure that the value's there and that we drive the best plans possible. We're going to be changing our third-party administrator to Health Comp. We've received some feedback that the old TPA Health Scope was not very strong, so we are changing to a better administrator. We think that will be a positive change. And also going back to bullet point number 1, we're going to be making a change to the medical carrier and network. It's now going to be the Blue Shield and Anthem Blue Cross networks. And as a result of that, it's going to be a larger network of doctors and better discounts, which is better outcome for the employees because they're paying a percentage of benefits. They're going to reap the benefits of having lower out-of-pocket costs by nature of using a network with better discounts. So we'll talk a little bit about that later. Also, last year, TEAM-RMS offered one major medical plan and then a limited benefit plan. This year, we're making it more simple and offering all comprehensive major medical plans. All 3 packages, named the Gold, the Silver, and Bronze, are going to actually include medical, dental, and vision, and the benefits are tiered are going to differentiate by medical only. The dental visions will be the same for all 3 packages, but the Gold is going to be the richest plan, then the Silver in the middle, and Bronze the least rich, or the lowest premium rather, and the lesser benefits. So we're giving optimal option to everyone, and they all are major medical plans that qualify as adequate and affordable in regards to healthcare reform. So this is good news. They also happen to be very similar to the exchange plans and the medical plans, at least. So it's no coincidence that we're naming them Gold, Silver, and Bronze, because it very closely mimics. In fact, it's a little bit better than the exchange plans, and we'll talk about that later. Also, the premium costs are very affordable. We're going to talk about the costs. And then we also are changing our prescription drug vendor to a vendor that still accommodates a very large network of pharmacies called US Scripts. So that's going to be our new vendor. And then good news, dental vision is staying exactly the same. It's still going to be an indemnity plan where anyone can go to any dentist or vision provider and just get reimbursed accordingly. We do want to note that the life insurance is being terminated due to lack of interest. It was a small amount of benefits anyway. And also the Consulta-Doc was so underutilized. That was a telemedicine service that will also be terminated 10/31/2013. So what is open enrollment? By the time you're listening to the video, you're probably a new hire and you're past the open enrollment period. So all new hires who work 30 hours or more per week, which is according to the law considered full-time, after they've been working full-time 30 hours a week for 2 months, then they will be eligible for the benefits program on first of month following those 2 months, as you can see at the bottom of this slide. And the decision that one makes regarding their benefits package, whether it be gold, silver, or bronze, will be locked in until the next open enrollment period, November 1st, 2014. So make sure to put in some thought before you make your final decision. And the only time that one can add or drop dependents outside of this open enrollment opportunity as a new hire is going to be at the next open enrollment. I'm sorry, rather the only other time that one will make changes outside open enrollment would be due to a qualifying event such as a family status change like a marriage, divorce, a birth, or adoption of that nature. So who's eligible for these programs? That includes a spouse or a domestic partner, children or stepchildren, and part of healthcare reform now requires that plans cover children up to the age of 26. Used to be they had to be full-time students. That's no longer a requirement. They don't even need to be living at home, and parents can cover them on their plan up to age 26, and no forms are necessary to fill out other than adding them on the application, but there's no proof of student status or whatnot. An important issue here, um, pre-existing conditions will be excluded starting in 11/1/2014 as part of Obamacare, but until that point in time, so for this plan year that starts 11/1/2013, there still are pre-existing condition exclusions for anyone who's brand new to the plan that did not have prior coverage. So there is an exception to that. That would not apply to pregnancy. Pregnancy is always covered. That's a federal law, even if one did not have prior coverage. But for everyone else, if they were covered on the old Cigna plan, there is no pre-existing condition exclusions. But if you're a new hire and you're coming on the plan, you never had coverage before, and certainly have not had it for at least 63 days prior to your effective date, you would have a waiting period of up to 12 months for any condition that you had prior to coming on the plan. So just a heads up on that. And once again, that will change next year in line with Obamacare. So providers, once again, we mentioned that you're moving to a larger network. In California, it's going to be Blue Shield of California, and almost 9 out of every 10 doctors are going to be inside these networks. And that's a good thing because these plans, as you'll see, are in-network only plans. You have to go to access care and get coverage. You have to go within the network. So it's important that we chose a network that's very large naturally. Outside of California, Blue Cross Blue Shield are combined together. And one of the beauties of this plan that was the same as last year is it's called an EPO plan. It's an in-network only plan, but it is not, I repeat, not an HMO. Because it's what we call an EPO plan, exclusive provider organization. It basically means this: it's like a PPO plan that's in network only. You do not have to elect a primary care physician, and you can direct refer to specialists. Just go on your own, and there's no referrals required. So if someone wants to go directly to a cardiologist without going to their primary care physician first, you're more than welcome to do so. And also, when you at time of enrollment, you do not need to specify a specific primary care physician. So lots of flexibility. So here are the prices for the premiums. These packages are bundled together. I repeat, it does include dental and vision. So when you're looking at these rates, know that you're including coverage for medical, dental, and vision. And if you look at that bronze plan on the far right, that's an extremely low rate, $145 to get a major medical plan and dental and vision. That's unheard of in today's industry. And then if you want a richer plan design, you can go to the starred plan, which is the gold EPO. That's going to be closest to last year's Cigna EPO plan. So for those of you who just want to keep everything the same as possible, you'd stay on that plan. But for new hires, you're really going to want to make your decision based upon the pros and cons and outweighing the benefits of the price versus in premium versus the benefits that one receives. So I'm going to show these packages so you can make a better decision. When you're looking at all this, know that the dental and vision benefits are going to be the same for all three options. The only variance is going to be the medical and prescription drug benefits. So the gold plan on your far left is the most richest of the plans. Once again, it's very similar to the gold plan that's part of the exchanges, but it's actually a little bit richer than the exchange plans because it includes an extra perk benefit that really is geared towards the RMS population. That's covering DME and disposable items at a percentage share coinsurance up to a $5,000 per year separate maximum. And that's a fantastic benefit for a lot of the people who have the trust. They know that there's a need for this type of equipment, and RMS want to be sure that that extra benefit was provided. So all three programs have that deeming disposable benefit. The main difference between the plans is really you want to look at three things. The calendar year out-of-pocket maximum is the same. That's the most one pays in a given calendar year. You'll see that that's $6,000 per individual. That is lower than the ones that are available in the exchange. So that's a good news. And also, you look at the calendar year deductible. The gold plan does not have a deductible that's similar to last year's EPO plan. And then the main difference is really going to be the coinsurance. That's the percentage share that the patient pays towards costs of care. And the gold plan is going to be the insured pays 20%, insurance company pays 80%. And then the silver would be insurance company 70%, patient 30%. And bronze plan, obviously, patient pays 40%, insurance company 60%. So it's very tiered. And if one wants to have better benefits, they'd simply pay more in premium and can enroll in the gold plan. Now remember, all non-emergent care must be accessed at Blue Shield providers or Blue Cross Blue Shield if you're nationwide outside of California. That's a note at the bottom. That's hugely important. We wanted to make sure that our constituents and clients, that everyone thoroughly understood that home health care has some parameters. We all know that the trusts often include coverage um, that's outside of this benefits plan. So there are parameters set up for home health care to be used in certain circumstances. So please take a minute to look at these parameters. And the benefits are limited to 40 visits per calendar year. What is considered a visit? That's 4 hours per day is considered. 4 hours in a day is considered a visit towards that maximum. And these benefits are not intended to provide private duty nursing. In fact, private duty nursing is not covered at all. It's really intended for the events outlined on here. Now, to be eligible, your condition must be expected to improve in a reasonable and generally predictable period of time. It's meant to be for short-term acute issues. And also, the home health care agency must be Medicare certified. And all of these parameters, by the way, are used by Medicare and Medi-Cal. So that's where we developed these standards and felt it would be appropriate to apply it to the trust as well. Because remember, cost containment measures, the more careful we are to prevent fraudulent claims or claims that shouldn't be covered, the better for the plan to keep the premiums down lower. And this is just a reminder, private duty nursing is not covered. And so everyone should be aware of that, especially with your clients that you know are receiving that type of care. Then they should be aware that that's not going to be covered on the benefits plan. May be covered through the trust, but it's not covered on the benefits plan. Prescription drug, I had mentioned that we're changing to a new vendor called US Script. It's a very popular, strong network of pharmacies. There's a website here, or one can call to see if their pharmacy is included in it. But chances are we know that all the major pharmacies are included, and the only time you should really check is if you happen to go to your clients happen to go to a mom and pop pharmacy. They just want to double check that it's inside the network. It is a strong prescription drug program, especially for the gold plan on the far right. Once again, that's the richest plan design. You'll see that we tier the benefits here by retail 30-day supply, retail where you can get 90-day supply, and then we have a separate set of benefits for mail order prescription. So the gold plan is the richest of the plans, of course, and there's a real incentive to use generic medications. And then the silver plan is also quite rich, but if you are going to take advantage of the low premiums offered by the cheaper bronze plan, note that there's no coverage for retail 90-day, and also that there's a brand name deductible of $250. So that's what's going to help drive the lower premiums for the bronze plan, and everyone should be aware that the prescription drug benefit is not quite as strong on the bronze plan as it is on the silver and gold. And there is a co-insurance benefit as noted, where the insurance company is going to cover 60% and the individual will be responsible for the other 40% share after the deductible. So people are often asking us the question, so we figured we'd create this slide. What is the difference between the TEAM-RMS EPO plans versus the Obamacare exchanges that were popping up throughout the United States? Number one, people can waive the TEAM-RMS plan and try to enroll on the exchanges. In other words, anyone can enroll in the exchanges. However, the critical factor that everyone should understand is that one of the main drivers for affordability on the exchange is if someone qualifies for premium tax subsidies that would make their out-of-pocket premium costs lower. Because TEAM-RMS is offering an adequate and affordable coverage, your clients or the employees cannot legally, they're not allowed to receive premium tax subsidies. Why is this important? Because without the tax subsidies, the exchange is not going to be a cheaper price plan, and it also has a much smaller network. I'm also pointing out here, the exchanges and networks are about a third to a half of most of the private network plans. So if you're looking at, if any of your employees or clients were going to be looking at the exchange and say, compare it, they should know that those networks in the exchange are much smaller. So it's not really an apples to apples comparison to what the TEAM-RMS networks offered. The TEAM-RMS network is the full, larger Blue Cross Blue Shield networks, once again, not a trimmed down version that's offered through the exchange. Finally, and very relevant, if someone does go to the exchange, they pay for their premiums with post-tax dollars, where if they enroll through TEAM-RMS, it's paid for with Section 125 pre-tax dollars. So there's a definite benefit there. In addition, it should be recognized that these packages include full dental and vision material benefits. In the exchange plan, it may cover an exam, but it's not covering any vision materials, where this plan does for RMS. So a lot of huge perks and advantages that you should be aware of in case they ask you. Here's that dental plan again. Once again, same exact thing as last year, except for now we have a new third-party administrator. So when one files for reimbursement, they need to send it to the appropriate place, the new third-party administrator called HealthComp. Little note there at the bottom. And also note that this plan is very generous. It's a 1,500 calendar year maximum benefit, and that's a very strong benefit for any company. And in addition, we offer orthodontia coverage for adult and children, and that's also a very rich benefit. So this is, we have several other clients, and this is a very rich dental plan, so we encourage you to take advantage of it and highlight that it's a very rich option for your clients. The vision program is also very flexible. It's called an indemnity plan. That means that you can choose to go to any vision provider you'd like, and you simply get reimbursed. And you can see what the reimbursement levels are: $50 for an exam, $100 towards frames or lenses. Just a little reminder, when it comes to vision plans, you can get a benefit towards glasses or contact lenses, but not both. So one has to choose which one they're going to apply the benefit to. Here's a sample what the ID card will look like. We show this because you'll notice very highlighted very strongly is that the network, in this case Blue Shield of California, and then also listed as the third-party administrator, HealthComp, because that's where claims will be sent to for like dental vision for reimbursements. And also highlighted are the main copays. Once again, there'll be a different one for gold versus bronze versus silver. And we make sure to highlight that everyone sees there that this includes medical, RX, dental, and vision. In addition, if they flip over the card, there's going to be information for the pharmacy so that pharmacists know where to call if there's any problems. There's also a phone number if anybody needs a provider outside of California. And there's also the customer service number. So, and where to send claims to. So we appreciate your time here. This is just a few last reminders. Remember that once a new hire hits their waiting eligibility period, they must fill out an enrollment or waiver form. That way they acknowledge that they've been offered the coverage, and that's regardless of whether or not they're enrolled with a prior carrier. They want to make sure that they fill out the form. This due date applied at open enrollment, but for anybody who's a new hire, they're going to want to fill it out as close as possible to when they're eligible, which is the first month following 2 months of full-time employment. And once again, a big reminder, for medical to get coverage, one must go to in-network providers. You're not allowed to go outside of the network. There is no out-of-network benefit per se. For dental and vision, it's different. You can go wherever you want. And note that when you purchase a package, if you get medical, you automatically get dental and vision with it. So here, once again, is our 888 toll-free number and Alejandro's extension and email. So please call us if you have any questions. Alejandro is bilingual with Spanish as well. So we thank you for your time, and we hope you enjoy the benefits by the TEAM-RMS plan. Thank you so much for joining us. And please do call us if you have any questions.